Everybody experiences pain in the neck, in their back, in an upper or lower limb, or in other parts of the musculoskeletal system in their life. Generally, we need first aid measures to manage these. These steps are all that's needed to get through these things to allow the body's amazing self-healing mechanisms to fix things. In the first 24 hours of injury, follow RICE. Rest, ice, like a bag of frozen peas, compression, like a support bandage to keep swelling down, and elevate the area if possible. After the initial injury settles, gently mobilise, move, but do so avoiding what really hurts, particularly any movement like bending, straining or lifting that may have caused the problem in the first place. Take regular painkillers. A combination of paracetamol and ibuprofen, if tolerated, should be sufficient. Stronger painkillers sometimes are needed. After the first 24 hours, warmth is best, so heat bags, heat lamps, hot baths, and so on, keep the area warm. Support bandages in the healing phase are useful if they feel helpful. They help the muscles around an injured joint stabilise it, and they offer that physical support. Rubbing in anti-inflammatory gels or other liniments and so on can help, and mainly for the massage and warmth. Remember that touch is very healing in physical injury. If you're in need of further help and support, look on the York Physio website at yourphysio.org.uk, and you can refer yourself on that website for an assessment and further treatment if needed. Get well soon.